Ladies and gentlemen, please welcome to the stage Dr. Mike Skramstad.
Backstage, Greg once again reminded me that I have 12 minutes and 12 minutes exactly, but just in case, once again, I outsmarted Greg. So AI in 12 minutes. So obviously we're getting bombarded with AI everything. You know, everything we read on social media, everything that people are marketing to us about, it's all AI. So with such a big topic, I thought what I would do is just kind of show you some of the things that I'm currently using in my office. You know, when I look at AI, I think you can really break it down into three categories. We have administrative AI. You know, this is very popular. The last I looked, there was like 100 companies offering this. You know, do you want AI to answer your phones and things like that? So that's one way we can do it. The other way, which has been very popular, is going to be diagnostic AI. This is going to be your Pearl, your Overjet, your DS Core. And this, for many dentists, is where we're starting. So we're going to talk a little bit about this today. And the last is going to be design AI. So those of you that are kind of dipping your toes into manufacturing in your office or outsourcing parts or even smile design. For some reason on my social media, I've been getting bombarded with smile design software as an AI where you can submit a picture and then they'll give you back a smile design. So I'm going to give you some thoughts on that. So what I really want to concentrate on this short talk is really on the last two. The first one's just so broad, there's so many options. And I think that I would never be able to kind of even scratch the surface on that one, so I want to kind of concentrate on diagnostic and design. Now, the one I'm using in my office is Overjet. You know, they're very, very similar, but Overjet is obviously something that is assisting us in reading x-rays. And the concept is honestly quite simple. You know, there's three different things that Overjet is actually currently doing. There's Dental AI Assist, which is obviously the most popular, helping it read our bite wing x-rays. There's also insurance verification that has come out, and Voice AI Suite. Now, like I said, the concept is very, very simple. You know, us as dentists, we are trained to read radiographs. So for years, we've been sitting in our operatories telling patients, like, do you see the gray? And then do you see the lighter shade of gray? Well, that other gray is a cavity, right? You know, these conversations that we've had. So, you know, it's very, so the purpose of radiographic AI in my mind is just to better communicate with the patient. So if we just look at this bite wing x-ray, we can all clearly see, you know, the decay, we can see calculus, and what radiographic AI and Overjet will do is it'll take this image and then turn it into something like this. So now it's, I'm sure many of you are currently using this. It's just something where we can say, do you see the red? That's a cavity. And they're like, okay, fair enough. But it also does things like it shows us, you know, the amount of tooth structure restored. So it kind of simplifies the crown discussion a little bit, where you can see if over 50% of the tooth structure is restored and something needs to be done, that's a crown. You know, so it just kind of simplifies the conversations. And in general, when I look at radiographic AI, it's just empowering our patients to kind of see what we see. But it also empowers me to see the things that I might not have seen. You know, how many times have you actually saw a patient on recall, and then you see a cavity, and you're like, wow, that's really, really big. And then you go back on the x-rays like from a year later, and you're like, nope, that was there 6 months ago or a year ago. So it's not only helping the patients understand what I'm seeing, it's also helping me not missing something, which is super, super helpful. Now, one thing that I want to introduce is because currently radiographic AI is really helping us with our intraoral, like bite wing x-rays. But what you're going to start to see now is you're going to start to see CBCT AI. So Overjet will be coming out. I believe I'm one of the first people to actually show this. And the Overjet CBCT-assisted, it's called, is actually quite helpful. We have all these different specific things that we can actually look at, and then with one click of a button, we can have instant shortcuts to very procedure-specific views. So if you want to talk to a patient about implants, you can click the implants. The AI will switch to that view. If you want to talk about airway, you can switch to airway, endodontics, and so on and so forth. So this is something that I would really look forward to, because typically reading a CBCT in front of a patient's even worse than reading a bite wing. They're often horrified when they see the skull going around. So it's nice to have a little bit of an assist with the radiographic. Now, moving on to design and manufacturing, obviously there's 3 different ways that I look at AI for design and manufacturing. There's outsourcing. Some of you may not have any design software in your office, so you can outsource the design. You have full design, so many of the current AI software, or current softwares like exocad, CEREC, they're starting to incorporate AI into their softwares. And then, of course, the Smile design. Now, with outsourcing, this would be, for instance, like if you did not have a software, you could just take a scan of a patient. You could send it, this example is 3Shape Automate. It actually works pretty well. And for a fee, you can just upload your scans. They will design your crowns, and they will send it back as an STL file for you to either 3D print, or you can actually mill in your office. So the benefit of these softwares is you don't have to invest in a fancy design software. You don't have to spend the time on training. You can just have them do it for you, and it actually works quite well. Now, for those of you that have invested in software like exocad, it can be a little bit daunting. So where AI is helping something like exocad is it's just kind of giving some more common procedures like a splint design. It just automates it with a wizard. It does everything for you. It segments all the teeth, and it allows you to kind of move forward. It also has something for crowns. So if you're just getting into exocad, it will have an AI crown design, which will design the crown really, really quickly and allow you to kind of move forward without getting lost in all the buttons that exocad certainly has. Right? So it's just kind of an easy way to dip your toe into a software like this for more common procedures that you might be doing in your office without getting lost in the details. Now, for all you CEREC users out there, the future of CEREC is certainly in the cloud. We've known that. They've made that very, very clear. So what is nice about CEREC in the cloud is now you don't have to have any specific computer. You don't have to have any specific software. Everything can be just uploaded into the cloud. And once it's in the cloud, the AI will design your crown. And from the cloud, you can actually send that to all your manufacturing devices directly from the cloud. This is the future. I will tell you that every single software will go into the cloud with Dentsply Sirona. It's a matter of time. Your implant design, everything will go in there. So I personally like it this way because you're no longer restricted to designing on an acquisition center. You're no longer restricted to designing on one computer. You can actually go wherever you want and design. So this is a crown. It does a pretty good job. You can see the proposal in the final zirconia crown, and you can also see they got the occlusion pretty closely as well. Now, with Smile Design, this last case that I'll show you, Smile Design is really, really interesting because this is a patient that recently came to my office that was having a lot of difficulty communicating with her existing dentist. They just could not get on the same page, and she felt like her upper 4 incisors were too masculine, right? And the solution that they were trying to do is bonding. Now, this is a very difficult case you can't really bond this and change the edge position without actually prepping the tooth. So what I did is I tried to give her an idea of what a Smile Design might look like, just so we can get on the same page. Now, the difficulty with Smile Design is can you execute it? That's always been the difficulty. So nowadays with AI, you could simply just upload this picture into ChatGPT. I don't know if anybody's tried that before. ChatGPT actually has a pretty good Smile Design. It's going to make the patient look like 20 years younger, too, which is always good. But I don't want to show this to you. I mean, this could open a can of worms that I don't want any part of. But all these Smile Design softwares that are doing is they're using AI facial mapping and something called zone composting. And you can actually take this picture and you can animate it. So on the right-hand side, this is just AI animating that picture of my new Smile Design. Now, what I do not like about these solutions is it's extremely difficult to know, can you execute it? There's no biology, there's no bone, there's no tissue, so it's a little bit unrealistic for me to propose this to a patient without knowing if I can do it. So one of the lectures, the last lecture, Dr. Shu from Germany, started talking a lot about SmileCloud. Now, this is a solution that I personally use. Now, the reason SmileCloud is so nice is you can still go through the same steps. You can still go through and you can design a smile, right? Now, the difference is it's more age appropriate, so I like that part of the AI a little bit better, so it actually looks like her. But the best thing about SmileCloud is you can actually incorporate other information before you do the final smile design. And what I mean by that is there's something, so this is my initial smile design on this patient. Now what I do is I go into something called the blueprint, okay? Now with the blueprint, what this means is now I can incorporate intraoral scans, I can incorporate CBCTs, and the reason SmileCloud is so impressive with this is because it automatically stitches everything together, the AI. And what this would look like is if I go ahead and click on Blueprint, it's say incorporate the upper scan. You click on that, you can see the AI automatically matching it to that portrait picture. I'll click on the lower, same thing, it's going to automatically stitch that in there very, very quickly. And lastly, I can click on the CBCT, and it's going to automatically segment the CBCT and stitch it into my scans in my portrait picture. Okay? So now that I have this, look at that little circle. I can design the smile, and I can take into consideration the bone, the soft tissue. I'm going to be able to know, can I move a tooth into that position realistically, and would that be something that would work? Right? So this is why SmileCloud is so popular in Europe. It's starting to come in the US. This version of the software should hopefully be available very, very soon. He's been saying for a long time. But now that I have all this information, now I can take it into the AI and come up with a plan. And so when I present to the patient, I have the smile design on the left, and then I can animate the AI on the right to show her what is realistically possible with her smile. So these are things that I think are going to be applicable in my office, and things that I'm using every single day. And I hope that you got a couple ideas. Thank you very much.